All right, it looks like we're just about ready to get started.
Megan, I think you can go ahead.
Okie doke. I'm Megan Shebick, trustee and grant committee chair at the Dupage Foundation. The grant opportunities we'll be talking about today are being offered through the Dupage Community Transformation Partnership, which is a collaborative endeavor between Dupage Foundation and Dupage County. We're very excited about these opportunities and look forward to all that we will accomplish together. Our information session today will be 30 minutes, with information provided followed by a question and answer period. Please provide your questions in the Q&A area, and we will answer as many as possible. Frequently asked questions will be added to our website. Slides from our presentation today will be sent to you later today. Thank you for being here, and I'd like to introduce Mary Keating, Dupage County Director of Community Services.
Thank you, Megan. I'm really grateful to the County Board for voting to create this partnership with the Dupage Foundation. As I'm sure you know by now, the board granted $10.6 million in American Rescue Plan Act funds to Dupage Foundation to administer a 5-year grant program. The goal of this program is to support social service agencies that are providing assistance to Dupage residents in the areas of food insecurity, housing instability, mental health, and substance use disorder. We've put together a committee made up of foundation and county board members, foundation and county staff, and a community member. And together we've crafted this program, and we're extremely excited to finally launch it. This is an exciting opportunity, and there's already been a lot of publicity about the partnership between the foundation and the county. That's generated a lot of questions. And so our purpose today is to provide details about the program and answer your questions. Now I want to introduce Barb Stepaniak, Vice President for Programs for Dupage Foundation.
Thank you, Mary. I want to start out by talking about how thrilled we are to have this opportunity to use these funds to support those who have been impacted by the pandemic and to reimagine the delivery of services to affect long-term impact for Dupage residents. Throughout the pandemic, we have observed a significant increase in food insecurity, housing instability, mental health, and substance use disorder. So this grant program will be focused specifically on those issues. And with that said, we know that there are many organizations doing great work, and there are many in need of funding to support that work. However, we will be laser focused on these 4 issues. And unfortunately, that does mean that we will not be able to fund every type of organization. So I'd like to start out with talking about the eligibility. Organizations eligible for this grant program are 501c3 social service agencies in which more than 50% of individuals served are in DuPage County residents. If your organization serves a larger area, you may be eligible if you have a facility in DuPage County from which you deliver services. So for example, some agencies serve the entire Chicagoland area, but they have an established center right here in DuPage. They would be eligible. If you don't primarily serve DuPage and don't have a center here, you may still be eligible if you have an advisory board that is specifically focused on programs geared toward the needs of DuPage residents. However, in that case, you will need to show evidence that the advisory board has been operational for a while. And regardless of the criteria that makes your organization eligible, all applicants will need to show a direct connection to one of the issue areas. So through the Dupage Community Transformational Partnership Grant Program, I know that's a mouthful, but I really do want to emphasize that this is a partnership. We will be offering 2 separate application processes, one to support immediate needs and one focused on transformational programs designed to have long-term impact. I want to emphasize again, for both of these processes, we will be funding programs that are focused on eliminating food insecurity, promoting housing stability, and providing effective mental health and substance use disorder prevention or treatment programs. We're hearing about other grant opportunities emerging to address some of these issues. So we will be monitoring that funding, the funding that becomes available to our community from other sources to ensure that we're not duplicating funding and to be collaborative when possible. We also realize that the needs in each of these areas will evolve over the next 5 years. and we intend to remain flexible to address the needs and gaps and fill gaps as best as we can. So I'm going to start out by talking about the immediate intervention grant opportunity. Immediate intervention grants are intended to provide financial resources so that organizations can respond to immediate needs of their clients or to help an organization increase their capacity to deliver efficient service and resources. And some of the ideas that come to mind with this are the purchase of food, emergency financial assistance, rental assistance, or provision of mental health care for low-income clients. I'm sure you can think of others. And I kind of see these grants as being similar to those that were awarded through our COVID response fund when immediate relief resources were distributed. Immediate intervention grants will be awarded annually for the next 4 years. We'll be awarding grants this year, next year, and then in 2024 and 2025. And the minimum amount organizations can apply for is $20,000, and there is not a maximum. However, the appropriate amount will be dependent on the size of your organization, the scope of the need, and the number of residents that will be served. And the request should not equal your annual operating budget. The application process will begin with a letter of intent that will be due April 15th. Our evaluation team will review the LOIs that we receive and will advise all applicants via email the status of the request in late April. And at that time, selected organizations will be invited to submit a full proposal, providing the team with more detailed information. As I'm sure you can imagine, we don't know how many LOIs we will receive, but we do anticipate that we won't be able to invite everyone to complete a full application. The actual applications will be due May 27th, and grants will be awarded in late June. The foundation will be reporting annually to the county board on the impact of these grants, and the county in turn must report to the U.S. Treasury. So grant recipients will be required to keep track of and submit specific impact metrics regarding the populations and numbers served in a final report 1 year after the grants are awarded. And now I'd like to move on to transformational grant opportunity. Through the Transformational Grant Program, we are interested in supporting evidence-based programs that are focused on long-term solutions to address food insecurity, housing instability, mental health, and substance use disorder. And examples in this area might be to expand or scale current programs or to implement software that will change and improve the way a service is delivered. Again, as organizations working directly with clients, you likely have more ideas to transform the delivery of services. We're planning to offer additional information sessions in late April to provide more specific detail about the transformational grant opportunity, but we wanted to give you a general idea of the scope of the program because we know you'll need time for your board and staff to strategize how your organization can advance your work in one of these areas. And to help you start thinking about this, organizations will be eligible to apply for a 1-year or 2-year grant, and we plan to offer a second round of funding in 2024. And this process will also begin with the submission of an LOI, which will be due June 3rd. And just like the immediate intervention grants, the evaluation team will review the LOIs and will invite organizations with the most promising proposals to submit a full application. And that application will be due September 15th, with grants being awarded in October. With this opportunity, there will be no minimum or maximum request amount. But again, the appropriate amount to apply for is related to the size of your organization, the scope of the need, outcomes you'll be measuring, the long-term impact you intend to have, and the number of residents that will be affected. The final grant guides will be posted on the foundation's website next Thursday, March 24th, and we'll also email the guidelines to everyone who attended today's session. The LOI application for the immediate intervention grant will also be available on that date. All of the LOIs and the applications will be submitted through the Dupage Foundation portal, which is listed on our website. So if you have applied to the foundation before, you should use that account for LOI and application submission. If you have not applied, you'll need to create an account when you initially go to the site. Organizations may submit an application for a grant through one or both processes. And as always, we encourage you to allow ample time to to get LOIs and applications submitted by the 5 o'clock deadline on the specified due dates. Many of you probably know this. The foundation is very strict with our deadlines, and we will not accept any late applications. And in the past, I'll just say we've had applications submitted just minutes after 5 o'clock, and we didn't consider them. So finally, I just want to talk a little bit about some of the questions the evaluation team will be considering when assessing grant LOIs and applications. And they are, is the community need relative to the request clearly described? Is there a clear description of the program, evidence of the strategy's effectiveness, an indication as to how outcomes will be measured? Has the population that will be served been negatively impacted by the pandemic? And will resources and services be deployed in an equitable manner? Has the organization demonstrated that they have the capability to provide detailed reporting on the use of the grant? Does the organization have experience providing programs in one of these issue areas? Is the organization financially sound? So the funds for these grants were initiated by the federal government. So as mentioned before, we will be reporting back to the county, and they subsequently must report to the US Treasury. And as a result, we need to collect more financials than we usually do. Unfortunately, we understand that this means that some organizations may not have all the financials that we are requesting. And without that information, they may not be eligible to apply. Finally, there will be additional factors that will be considered depending on the specific area of each of the grant request areas. So finally, I know we've given you a lot of information, and now we would like to open things up by answering any questions you have. And as Megan mentioned earlier, please enter any questions in the Q&A section, and we'll try to answer as many as possible, and we'll post an FAQ on our website. And with that, I'd like to open it up to questions. Laura, do we have any questions?
Not yet, but we'll give people some time to answer them. In the meantime, I'll start maybe with a question for Mary. Do you want to give any more background or insight on why those 4 issue areas were chosen?
Sure. So I would have to say that those are really the 4 areas that the county board felt we were seeing the greatest impact of the pandemic, the greatest areas of need. Obviously, housing and food being, really crisis, immediate intervention, and then behavioral health, long-term mental health, substance abuse. Seeing that from the numbers of opioid overdoses, just general mental health issues. And so I think those 4 issue areas really bubbled up. Clearly there's been a whole host of issues related to the pandemic, but the board felt very strongly that these are the areas that we wanted to focus on.
Perfect. And we do have a question, Barb. I think this one's for you. Do you want to talk a little bit about what those required financials will be, or maybe what sort of information we'll need from grantees?
So we're going to require an organizational budget, a current organizational budget. We're going to require the past 2 years of audits. We have a financial indicators form, and organizations that may have applied through community needs saw that most recently. And that is taking information from your 990s from the past 3 years. And we will also require the most recent 990.
Awesome. There's another question in here. Are capital requests eligible through the Transformational Grant Program? Or maybe what kind of programs do we expect to be coming through there?
I don't think we anticipate funding capital requests. This is definitely more programmatically focused.
Perfect. There are a couple other questions about can organizations apply for both, which they can.
Yes.
But also, is there any indicators that should sort of steer an organization towards one process or another? Maybe what's the difference?
Well,
Go ahead, Barbie.
the immediate intervention grants are going to be for direct assistance people that, I would expect that organizations that purchase food, they might be applying emergency financial assistance, emergency rental assistance. So it's going to be getting funds into the hands of the organizations that would pretty much immediately get those out to those residents that have been most affected. Whereas the transformational grants are really intended to be for those projects that are going to change or expand a way a system or a program is being delivered. So those are really more long-term solutions to some of these most pressing problems. Mary, I don't know if you want to add to that.
Yeah, I think the transformational is really intended to be systems change, process change to impact the service delivery system, or really kind of the way organizations work together, or and so the immediate is to get resources quickly to the agencies and then quickly to the beneficiaries, as opposed to the transformational.
And I do anticipate with, for example, the transformational, that may be a really a collaboration among organizations working together that are addressing similar programs. There are, as I mentioned earlier, there are a lot of opportunities coming down the pipeline for, in particular, mental health. And there's going to be a lot of funding available. So this is really, I look at this as the once in a lifetime opportunity to really think carefully about how you and your organization can advance solutions in these issue areas, particularly with the transformational grant.
And maybe to go back a little bit to the immediate intervention grants, there's a question of, since those are awarded annually, can an organization reapply for additional funding each year?
Yes.
Which is yes. This might be a good question, maybe a little specific. What about an organization with a location located outside Dupage that is serving Dupage County residents? Barb, do you want to talk maybe a little bit about those Dupage requirements?
So if an organization has a center here in Dupage, you serve more of the Chicagoland area, but you have a center here in Dupage, you are eligible. Also, if you have a board that really is focused on providing programs that meet the needs of Dupage, you might be eligible. But we really do want to know that that advisory board or whatever has been up and running, and it's not something that you just put together tomorrow and apply.
There's a question here about guidelines on which costs are eligible, not eligible. Example, personnel retention, sign-on bonuses. I think the important thing to remember is that there has to be a tie-in to the specific impact of how would sign-on bonuses impact housing insecurity for the client. So there has to be, whatever the proposed use is, there has to be a measurable impact on one of those four areas. So the measure couldn't be employee retention. That would not be an adequate reporting metric for something like that. There was also a question about, I think we have answered that agencies can apply to both. There was a question on whether there would be any disadvantage if you would applied for immediate and then also wanted to apply for transformational. They'll be taken completely under consideration as completely separate applications. So there's no advantage or disadvantage to applying to both.
There is another question here. Can an organization submit multiple requests within a grant category? So within immediate needs or within transformational?
Well, we really hadn't talked about that. So that's an interesting question, actually. Since we are doing an LOI process, that's how we're going to learn about some of your ideas. So unless my committee members disagree, I would be interested in seeing if you have multiple thoughts, multiple programs. I guess I would say I would be interested in seeing them. And then the committee would have the opportunity to look at those and see if, one or another, I don't know, both. I mean, the goal of this is to really have impact, long-term impact. So, just like with COVID, the COVID response fund, we're kind of working through this as we go along, and we're waiting to see what we're going to get. And I think we'll be able to answer that better maybe in a couple of months. But that is a good question. And since we are going to have an informational session regarding the transformational grants, that's something we will talk about.
I also think that, we're quite aware of the fact that we will not be able to fund every single application or idea. So I could foresee a circumstance under which we might go back to an agency and say, hey, you've submitted 3 LOIs. We really need you to prioritize 1 or 2. You tell us which one, if we can't fund all 3, you tell us which one you think has the greatest chance for success. So I agree with Barb that it would be great to see a lot of different ideas, but we may ask agencies to narrow their focus. There's a question about eligibility of residents who may not be citizens. We are silent on that. There is no there's no guidelines regarding, or there's no restrictions regarding the beneficiaries.
There are also a couple questions about reporting metrics and if they are going to be preset in the application, or if organizations will set their own. I don't know, Barb, that might be for you.
I think we're going to, organizations will be, through an application, will be establishing what they would be reporting. But for example, the immediate intervention grant applications, that, the population served and the numbers that you serve at the final report, you would have to report. You need to be keeping track of it throughout the year, because we will be reporting back how many people were served, what was the population that was served. So that will be definitely something we'll be looking for in the immediate intervention grants. But there will likely be others, and we would give that at the time that we do the application. We would be gathering information like who are you serving when we have the applicant get to the application process.
Another question is, will grants initiated by collaborations between multiple organizations be considered?
I think not only considered, but encouraged.
Yeah.
Right.
But there would have to be obviously a lead organization that would accept the grant and be responsible for meeting the deliverables and reporting back.
There's a question.
Along that lines, there may be multiple collaborations. So an organization might be working on multiple programs and might be a part of a collaboration. I don't know how to say this, but they may be working on multiple programs, even if they're not the grantee. I don't know if that made sense, but.
This is a question that I can answer, but Barb, if you want to add any additional color, would a successful grant application preclude an organization from other Dupage Foundation grants, which would be our community needs or any of our other grant programs? And no, this will operate separately. So getting a community needs grant or getting a transformation partnership grant will not preclude you from applying for anything else.
We have separate processes. We have separate committee members looking at, there is some crossover, but there's definitely a committee working with our community needs and a committee that is looking at the partnership grants.
And there's a question, as there's no maximum grant amount requested ceiling, is there a limit, like 30% of the program cost or any sort of threshold?
We have not set a limit, but really, as I mentioned, if you are asking for a grant that's 50, I think you said 50% of your operational budget, we would not be interested in that. Mary,
Right.
You might want to add to that.
Yeah, I think agencies need to think very strongly about their actual capacity to manage. So if it's the immediate intervention, it's a 1-year grant. I think we would be concerned if we saw something that was, so an agency was looking to expand our capacity by 50%. That would be a I think that would give us pause. So while there is not, we're not drawing a hard and fast line, we are saying, please be realistic about your internal capacity.
Mary kind of touched on this earlier, but there are a couple questions on can indirect costs, administrative costs, overhead be included in the grant budgets or the grant requests? I don't know who wants to take that one.
I think so.
I would
Right,
think so
Barbara?
too.
Yeah.
Yeah. I mean, you can't deliver a program without having all of that. So
Mhm.
I would
And
be
there-
concerned actually if the program didn't have some of those. But it has to be reasonable too. Go ahead, Laura, I'm sorry.
Oh, no. There are a couple other questions about financials required to apply if they don't meet a threshold for an audit and they have a 990, or if they have financial compilations instead of an audit for the last couple of years. Barb, I'll hand that one to you.
Yeah, we are requiring an audit. So you will have to produce that. And I do understand that does mean, and we'll actually have to have 2 audits. I don't want an organization to run out and get an audit just in hopes to get a grant, but for this particular opportunity, we are going to require it. And part of that is because the funds were initiated through from the federal government. We have to report back to the county. They have to report to the US Treasury. And that's just one of those documents that really shows that the finances have been viewed by an outside source. So that really is important. And I'm sorry, it does preclude some people from applying.
And do we have, Barb, this might be for you again. Do we have sort of an expected number of organizations or grants that we think we will award in each category?
Mary, you can answer that one too.
How many?
We don't. No. This is obviously this is the first time we're offering this opportunity, and frankly, we know there's a lot of interest. We've gotten calls, and there are a lot of people participating in both this session and next week. So we just don't know what we're going to get. So that is really why we are doing the LOI, because we want to make sure we want to look at that, and if an organization doesn't meet what we're looking for in each of the categories, we're not putting them through putting an application together.
Oh, go ahead.
I'd like to thank everyone for participating in our session today. Thank you to Barb and Mary for all the information you've provided. We have reached the end of our 30-minute session. Frequently asked questions will be added to our website. Slides from this presentation will be sent to you later today. A recording of our information session will be posted to the website along with the guidelines on Thursday, March 24th, when the portal for immediate intervention grants will open. We're very excited about this partnership and look forward to everything that we can accomplish together. Thank you for participating today and have a great day.
I just want to say, if there's any questions that were not answered, we will try to answer them and make sure, like Megan says, that they are added. So, thank you.
Thank you.